Everyone, what's up? It's Dr. Charlie PT. Wanted to shoot a kind of short video today to answer a question that I got from someone regarding their sciatica. So for those who don't know me, again, my name is Dr. Charlie Johnson. I'm a physical therapist. I have my orthopedic board specialty, and essentially I help teach people with unresolved back, butt, and sciatica problems how to heal themselves so that they don't need to rely on other folks. They don't need pill shots and surgery. So that being said, what was the question? So actually not even really, sort of a question, two parts here, right? So one was just sort of an update and says, hey, my sciatica is now just a dull pain instead of a shooting pain. I'm reading this on my phone here. Does this mean that it's healing? So it's a really good question. So look, if your symptoms are changing and they feel as though they're moving towards the positive, all right, then absolutely, it might appear that things are healing. But there's a more objective way that we can kind of sense whether or not we're moving in the right direction or not. Real quick, the purpose of this video is not to tell you if you have sciatica or help you determine that. If you've already been told that, cool. If you're not so sure, be sure to check out my DIY diagnostic guide, where I literally walk you through a complete flowchart of my brain on paper in digital format, such that you can figure out what could be going on and what could be the cause of your symptoms. That being said, how can we tell if your sciatica is getting better or not? So the number one test to determine if you have sciatica or some irritation of the sciatic nerve is something we call a straight leg raise. And you don't have to be, make this fancy or get this exactly right. But the idea is this: if you're sitting here, and let's just say you have sort of pain of tingling going down your right leg, right? If you try to sit here and straighten out that leg, you won't be able to do that if you have sciatica. I pretty much guarantee it, right? Especially if you have tension and the foot is pulled up, that will feel worse if the toes are pointed, all right? So again, if the toes are pulled up and you try to straighten your leg and you're doing something like this, chances are you will get to about here and you will say, I'm done. I just can't do it anymore, all right? You might also know that you have what we call a cross straight leg raise. So not only is the right leg yucky, but the left leg, you can get up a little bit higher. The symptoms are on your right, but raising the opposite leg, the side where you have no pain, causes some pain on your painful problematic. So again, you have right leg pain, ow. You raise the good leg, it can also cause some pain on the bad side. All right, so that is a straight leg raise. Again, if you need clarity on that, check out my DIY diagnostic guide on what that means and how it fits into that kind of diagnostic picture. But that being said, that is a really nice objective measure of sort of how sensitive the nerve is. So if you're doing that test, ow, and or ow, then that is a yucky motion, all right? And at the end of the day, diagnostics are cool, but yucky motions are cooler. And the reason that they're cooler is because they give you really an objective sense, something that you can see and you can feel, which is really neat because you're the one actually experiencing sensations, and you can tell if that is improving or not. So in this case, right, somebody's saying, hey, it was sharp and shooting, but now it's kind of like this constant dull ache. Well, I mean, I guess it depends, and it's kind of all contextual because you might like the dull constant ache, but maybe the occasional twinge or shooting pain was actually better because maybe it was less frequent and now it's just dull and constant, right? So that's kind of a little bit fluffy. But look, if it feels better, great, that's awesome for you. But what you would want to do is you would want to say, hey, look, right now, and again, stop as soon as you notice something. But if you have sciatica, chances are really good that you probably have this test, which feels yucky, and it's difficult to straighten the leg however you want to do that. All right. Again, you don't have to be, there's no like perfect exact way to do it. Trust me, if you have sciatica, that's going to be a problem. All right. And maybe you even have it on the other leg. All right. But you probably have one leg at least where that is somewhat uncomfortable for sure. All right. And what you want to do in your brain is you want to write this down. You can write it down on a napkin or anywhere on the fridge. Doesn't really matter. And 0 to 100. 0 is no yuckiness. Woohoo, no problem. Right. 100 is really, really yucky. Like, the yuckiest thing ever. All right. Please don't put yourself into 100 yuckiness, but the idea is just do it and get a sense for how well it feels, right? And kind of how yucky it is. And put a number to it. So if it's kind of high yucky, 80, 90, 100, something like that. If it's low yucky, 10, 20, 30. If it's medium yucky, maybe like 40, 50, 60, 70-ish, something like that. All right. So that being said, you write that number down. And then next week, after you do a treatment, as you move forward, instead of just being like, hey, my symptoms are kind of changing, is it good or bad? And kind of having this really fluffy idea about whether or not things are improving, go back and check to see if that yucky motion or motions, if both legs were yucky, is improved, right? So in this case, I would tell this woman, hey, again, sensations are one thing, but did you check your leg raise? Yes, Charlie, I checked my leg brace and it was an 80 last week. Okay, now I know symptoms have changed. I'm glad they feel maybe somewhat more tolerable to you, but now go ahead and recheck that leg brace. All right. If it was a number, I can't even remember the number at this point. Let's just say it was a 70, I think. How is it now? Okay, you go back to your fridge, you go back to your napkin, whatever it is, right? You go back to your phone, and oh, now it's a 40. Great. And what that tells me is that the motion is improving, which means that sciatic nerve, which runs down the back of your leg all the way to your foot, is becoming more tolerant to stretch or strain, which is great. All right. So again, the question of, hey, my sensations are changing, Charlie, and I had sciatica or I have sciatica, and what started off as this sharp shooting pain has now become this constant dull ache. Is that good or bad? Well, I'd say it's hard to say. Do you like it better or do you not? Right? It's great, again, if you feel better overall, but at the end of the day, I'd say, how is your movement quality? Is your movement quality improving? Meaning that test, which is very good at picking up or determining if you have sciatica because it stretches the sciatic nerve, you go ahead, you would do that, and you'd say, okay, how bad is it? And you'd objectify. And ideally, you would have done this already, but if you're watching this video, do it now, right? And then in a week, in 2 days, in 5 days, doesn't matter, just pick a cadence every 4 to 7 days, check in and see if that leg or legs, if you have a cross straight leg brace, is getting more tolerant, all right, more tolerable. If that motion is becoming less yucky or more tolerable, all right? And if it is, that's a good sign that the nerve is becoming less sensitive, in which case you should keep doing whatever you're doing and not change a thing, all right? So hopefully that's helpful and it gives you more of an objective read if your sciatica or your sciatic situation, for lack of better terms, is improving or not. That's the most objective way that I can think of, and it's something super simple that you can evaluate too, so you don't need to keep going back to someone to tell you, hey, this is working or this is not working, because you can just check it for yourself. All right, so hopefully that's helpful. Again, this is Dr. Charlie. If you like this or you enjoyed this, then please like, subscribe, comment below, and again, check out that DIY guide. Put a ton of time and effort into that, and I know you'll love it if you're wondering what the heck is going on and what is the cause of your back, butt, or your leg problem. So hopefully that is helpful, and we will see you in the next video. Thanks.